if you remember, the last episode was the beginning of refer pain. What does refer pain means? Refer pain has different classifications as we talk about sinus pain, ear pain, heart pain, also trigeminal nerve, trigger point, pain coming from the muscles referred to the teeth, and also we have the psychological pain. I will talk about that. But there's one that is very important for us in root canal treatment. When the pain is referred from one tooth to the next. Like I will show you in a patient I have where he needed a root canal on one specific tooth, but he was grinding so much. He's a famous writer, and he was grinding to the point that he fractured the tooth next to it because he was not wearing his night guard. So in that situation in particular, where he has pain in the two teeth, we have to do the two root canals. I will show you that case in a second. But most importantly now, talking about the trigeminal nerve, what is called trigeminal nerve? The trigeminal nerve is one of the cranial nerve, is the fifth of the cranial nerves, and it has one orbitary, if you see here, one of the extensions. This part is gonna innervate part of the orbit. Also, there's a maxillary one that is gonna, the branch is gonna do the innervation of this upper teeth, and there's the lower, which is gonna do the innervation of the lower teeth. And it's a trigeminal nerve, like a patient of mine said, and friend, that is because it's three branches that we have in trigeminal nerve. And that's why sometimes refer pain is difficult to diagnose when it's coming from patients that have a condition like a trigeminal nerve situation. We usually send them to orofacial pain specialists. And they're gonna do several of the testing where they're gonna check if the pain is coming really from a trigeminal nerve after we do an endodontic test, or is coming from a tooth. Because sometimes he will lower the acute situation of the trigeminal nerve with different medications. Gabapentin is one of them. Or sometimes after several studies, the pain is managed and the tooth has a problem, and sometimes the tooth can trigger the trigeminal nerve and vice versa. Now, situation. The other part is a trigger point. And a trigger point, when the patient has this type of pain, just like similar to trigeminal nerve, but this trigger point meaning that you cannot even touch the tooth. You can touch the cheek and the patient starts having the pain on the tooth. So that means a trigger point somewhere in his face is referring the pain to the tooth. So we're not gonna do a root canal. So be sure when the testing is not conclusive, when you have pain with cold and the pain goes away, or you bite, the pain goes away, that is not a root canal. We are just talking about a situation of a trigeminal neuralgia or a trigger point. But there's another one where it was a case at UCLA, this was very famous, it was published, where a patient was having pain on a lower jaw. And this is fascinating why even this patient ended up in a lawsuit against the particular person that was dedicated doing the diagnosis. So the patient said, I have pain in this tooth. Now I have pain in this one. And now, no, I have pain on the upper. I have pain, no, I have more pain on the lower. So they start doing root canals one by one. The patient continued with acute pain, and they extracted all the teeth of the quadrant. The patient continued with the pain. So the whole department was going out of their mind until somebody asked, what is your job? And the patient said, I play the violin. So the fact that the patient was playing with the violin and have this type of contractural muscle so intense that it was the pain referred to the whole jaw of the patient. In the meantime, the patient lost all the teeth. So what is the conclusion I wanted to tell you about this type of situations? Be sure when you see there is some kind of uncertainty just be sure to tell the dentist, I want to wait. Please, I want to see an orofacial pain doctor. It's not normal that you're going to have pain in one tooth and then the other and the other and the other and be doing root canals in the whole quadrant when it's not necessary. So this episode is about to tell you that not every toothache is a root canal. Not every amount of teeth that are hurting you is going to mean be aware sometimes the whole teeth are bothering you. One time I wake up with so much pain in one tooth, and guess what? It was because I was not wearing my night guard and I was grinding more specific in that tooth. So I have to see Dr. Bijak. He did a night guard for me, and the problem was arranged. Like we have in this case, I am going to show you right now. As you can see, this patient came and has some sensitivity on the teeth. And he was sure it was something, a shadow here. But we took another angulation, and it was not any shadow. We did the testing and everything. When you see here in the screen, this area where I show you is the cold test in every tooth, the bite test, percussion, palpation, and we write it down with different dates, with different ink. We analyze the data, and we said, this is not a root canal. Please wear a night guard. The grinding of this patient was excessive. So they have a night guard, and remember, the night guard is only to protect. It will not treat bigger conditions on the TMJ per se, but it will protect all the occlusal area of the teeth. I don't make the night guards. Your dentist should be able to do it, or your prosthodontist, the prosthetic dentist, or orthodontist also can make them. Periodontists also, I know they're doing the night guards. So be sure it's not your grinding habits that you have. And you can have many different situations where the patient has said, I have pain with cold on my lower left area, and the root canal was done 2 years ago. I've been kneading on that side, but also the pain disappeared in any given moment. And what I found on this patient is the patient sometimes they can have a cracked tooth. And what do you do when they have a cracked tooth? They can be positive when you do, we call it percussion, where you're tapping the tooth is one of the exams, or the biting. And that means they need a root canal. They're not going to need they don't need a root canal. They're going to need a night guard, and the problem is going to be arranged, So we have different cases. This topic of refer pain is very important for you to know. We will talk in the future about how a tooth infection also can cause the death of a patient when it goes to the spaces of the brain, which is not part of this topic, but I want you to be aware of all of these situations that can affect your health in general. In this case, why? Because you don't need a root canal, and you can save the time, the money, the efforts, and be sure you're seeing the right person to do the diagnosis. I hope you like this episode. If you have any questions, let us know through the comments of YouTube or Instagram. Thank you. Bye-bye.